Hello, everybody. My name is Jordan Quatrucci. I am in the School of Pharmacy within University of Charleston as the Director of Student Affairs. This is my service project, Improving Vaccine Confidence, a collaborative approach by the University of Charleston. If you did not know, HB 5105 was passed by the House of Delegates on 2/26/24 and is being looked at by the Senate. It is named the Prevention and Control of Communicable and Other Infectious Diseases. If passed, HB 5105 will move West Virginia from having one of the most effective school and child care immunization requirements in the nation to having one of the worst. By removing immunization requirements for private and parochial schools and allowing a religious exemption to immunization requirements by schools and licensed child care facilities, it will become easier and more convenient for parents, guardians to opt their children out of immunization requirements and vaccinations. This will lead to a reduction in immunization rates in West Virginia and put our children and communities at risk for the return of vaccine preventable diseases. Vaccine facts. This is particularly concerning for young children, in childcare settings especially. Young children are at a high risk for complications of vaccine preventable diseases, and children under 5 are not eligible, or children under 1 are not eligible for MMR, measles, mumps, and rubella vaccinations. These children rely on high immunization rates and the people around them to prevent the spread of measles. Allowing a reduction in immunization rates around them will put them at risk for dangerous but preventable diseases. More than 400,000 children worldwide die yearly from preventable diseases. Although the MMR, measles, mumps, rubella vaccine is widely accessible, measles deaths in children under 15 have climbed 50% from 2016 to 2020. The Lancet is the famous 2010 landmark study that linked MMR disease to autism rates in children, which has since been redacted, both published by the CDC and World Health Organization and by the Lancet, who published it in the first place. All of these deaths and adverse reactions are tracked by the CDC and FDA through the Vaccine Adverse Event Reporting System that tracks, again, vaccine quality. By looking at the VAERS, it tracks all sudden infant death syndromes in relation to vaccines, all vaccine-related infection deaths, and any death that could occur shortly after a vaccine. Yearly, the VAERS concludes no causal relationship between required vaccines for children and death. Vaccine preventable diseases are just a car or plane ride away. HB 5105 will open the door to return these diseases to our communities, putting children, particularly those who are most vulnerable, at risk. We ask that this bill does not jeopardize the health and safety of our children and community by weakening West Virginia's child care and school immunization requirements. So what can we do about this? Every year, UCSOP, the School of Pharmacy, conducts a vaccine clinic for University of Charleston's community, so faculty and staff and students. This year, I would be proposing a full season community vaccine, a fall season, flu season community vaccine clinic. So when this would happen would be the fall of 2024. Where would be in Pharm UC, and the who would be a much wider range than we're normally used to. So in conjunction with UC Pharmacy, Nursing, and Health Science programs, as well as UC Leadership, our community members, business leaders, Board of Trustees, and inviting the West Virginia Senate and House members, we would conduct a massive flu vaccine and vaccine confidence and immunization clinic. The purpose would be to allow people to come to campus and talk to people, professionals in the field, asking them questions about vaccine safety in children, different adverse reactions of vaccines, and the effects of not having vaccines in childcare settings. The purpose of this would be to establish confidence and trust in our community. Instead of people hearing information on the news or through unreliable social media sources, they would hear from their community members that they may be dealing with every day: doctors, PAs, nurses, pharmacists, and the students who are going to future become them. That's something we can do as a community, so that could be spread between news services. Not only can it help the community of Charleston, but the entire state of West Virginia to realize that HB 5105 will only weaken our vaccine confidence and weaken our immunization records in children. What can I do? What can you do just as an individual? At this time, before that vaccine clinic, we can contact the Senate Health Committee. Senator Mike Maroney is chair and Senator Tom Tabucco is the vice chair. You can find their emails on the West Virginia Senate page in a simple email that says, "My name is, and I'm calling to ask the senator to vote no on House Bill 5105, or I am emailing to ask the senator to vote no on House Bill 5105. We ask you to please keep calling and emailing members of the Senate Health Committee and asking them to oppose House Bill 5105. Not only would I like to do a vaccine confidence clinic in the fall, but set up a University of Charleston call center at a specific day to call the Senate members before this bill is looked at even further. We would like it to be essential for our opposition of this bill to be very loud and very repeatable over a short amount of time, so our Senate members can understand the grave danger of this bill being passed and the importance of vaccine confidence. Thank you for taking the time to listen to this presentation. Hopefully we can enact this service project. I look forward to possibly working on the future to make this happen. Here are some of my resources taken from West Virginia Legislative.gov if you'd like to go read the bill yourself, as well as the CDC, VAERS reporting, and the World Health Organization, as well as the initial Lancet report that initially caused this outbreak of hysteria between linking MMR vaccine to autism, that has since been redacted as well. If you have any questions, I'd love to follow up on this. And again, hopefully we can enact this service project to restore vaccine confidence in the community of Charleston and the state of West Virginia.